Uniting is calling on the New South Wales Government to respond to the recommendations of the New South Wales Drug Summit report within the 6-month deadline identified by the summit's co-chairs, with the life-saving reforms recommended in the report. Now, during the week, I stumbled on this message from Dr. Marianne Jauncey and Emma Maiden on TikTok.
We have simply met with too many families who tell us that their loved ones would still be alive if they'd had access to a supervised injecting facility like the one I run in King's Cross.
Yeah, it's estimated that 500 people die from accidental overdose in New South Wales every year. That's 250 in the last 6 months alone when we've been waiting for this drug summit report.
Opiate overdose deaths are entirely preventable. It just needs someone to be there. But in New South Wales, we have an antiquated clause in the legislation that means communities don't even have the option to explore the benefits of a supervised hub and what that might bring. That's what we're asking the government to change.
Yeah, it's one of the recommendations from the Drug Summit report. It's only 96 words that we're asking them to abolish. So it's super straightforward and easy.
And it costs nothing.
That's right. And we have right now in communities people who are overdosing in public toilets, in alleyways, in public car parks. And all we're asking for is the ability for that ban to be taken away and for the ability for communities to begin to explore what that might look like for them.
It's not enough just to provide the syringes. People need a place to use them.
That's right. So come on, New South Wales Government. It's 6 months since you've had the Drug Summit report. Implement the recommendations and make sure one of them is the abolition of Section 36A of the Drug Misuse Act.
And one of the people featured in the TikTok video is the Director Advocacy and External Relations at Uniting, Emma Maiden. Hi, Emma.
Hi, Bill.
Hi. Now, tell us first about Uniting and the work you do.
Yeah, so Uniting is the service and advocacy arm of the Uniting Church in New South Wales and the ACT. And we provide care and support across every life stage. Yeah, and we're also working to create change so that people and communities can thrive. So we're a big not-for-profit organisation and we're really passionate about the work we do.
Now, Uniting runs the Medically Supervised Injecting Centre. How many lives have you saved or turned around because of the centre?
Well, we've actually, there's been 12,000 overdoses over the time we've been running the service over the last 25 years.
How many deaths?
Not a single death. And there's about 27,000 people that have been referred to treatment or other care and support services. So we've saved so many lives and we've changed so many lives.
Now, Uniting's calling on the New South Wales Government to respond to the recommendations of the New South Wales Drug Summit report within the 6 months deadline, but that's already expired. So what's the current status?
Well, we are still waiting, unfortunately, Bill. It is over 6 months, and that deadline isn't our one. It's the one that the co-chairs of the Drug Summit set for the government to respond. Look, we understand the government is working on their response, and we are hopeful.
Are they, Emma?
Well, we have heard that there is a working group working on it and that we'll hopefully have a response in the next 2 weeks. But our expectation of all our fair treatment partners, of the mums and dads around New South Wales, the community members, is that response be comprehensive, not a vanilla response. I mean, you don't hold a drug summit to just do something that's ordinary. The 1999 drug summit created the extraordinary injecting centre in King's Cross, which was, world leading at the time, and we just want to see a response that actually says we're going to implement every single one of those recommendations. There's only 56.
Are you hopeful?
I like to be a hopeful person, Bill. I really do. And I suppose our message to the government is that they should do it because we're not going to give up and we are going to keep campaigning to get every single one of those recommendations implemented.
Why?
Because our current drug laws are unfair. They're unjust, and they don't reflect.
What about people who say, well, they're risking their lives?
People
They'll let them risk it.
Well, I mean, I think every human life is so valuable, and we shouldn't discard any lives. We should be trying to save as many lives as we can, and we know that if we change our drug laws, that we can save lives and reduce the harm from drug use.
Because not only is what you're saying, but you've got a coalition of community services organisations, experts and health organisations backing you up. So you're not just speaking out of thin air, are you?
That's right. We've got over 70 partner organisations, a whole lot of different faiths, community organisations, legal representatives, doctors' organisations, a really broad range of community support. And we know the community really get this. We've done surveys around New South Wales, including in the Premier's own electorate. And we know whether it's Cogra or Bankstown that over 70% of the community support or don't support personal drug use being treated as a criminal issue. They want the system to change because they know that it will reduce harm and save lives.
So why do you think it isn't changing?
Well, look, I really think that, we don't want to get ahead of the government's response. And as I said, I like to remain hopeful. But I do worry that the Premier is listening to the wrong voices. There are... and that he's fallen behind with where the community is at on this issue. There is a small minority of loud voices who oppose change. But as I said, most people, including those in the Premier's own electorate, support there being a health and well-being response to drug use. And that's what the evidence shows saves lives and reduces harm.
So how unfair and outdated are the current drug laws, and what kind of stigmas do they perpetuate?
Well, they do create a huge amount of stigma. I mean, when we had the 1999 summit and New South Wales established the injecting centre in King's Cross that we run, we were really a leader, and now we're a laggard. And what happens with our unfair drug laws is instead of actually creating pathways for people to have conversations around their drug use, it actually pushes people into the shadows. It disconnects people who are using drugs from the people who love them, their family and their friends. And because it's seen as really shameful and there's a lot of stigma attached to it. So what we need to do is to change those laws so that we can create those pathways for people who are experiencing drug dependency to reach out for help.
Now, the Pennington Institute's recent report makes for sobering reading. Could you tell us some of the more alarming findings?
Yeah, so it shows, these are Australian-wide statistics here, but it shows that the equivalent of a Boeing 737 full of Australians are dying of drug overdoses every month in Australia. That's like 189 a month, 6 people a day. That's people's sons, daughters, brothers, sisters.
People would be shocked to hear that, wouldn't they?
Yeah, it's outstripped the road toll for a number of years, and it's been over 2,000 deaths for over 10 years. And yet, where's the talk about this? These are human beings,
and
loved people.
What you were saying was all of these deaths are preventable.
That's right. Every opioid death is certainly preventable. We know that from running the injecting centre. And if I don't know if you've ever had a chance to visit the injecting centre. We do run tours before we open in the morning. And the first step if someone overdoses is actually just to give them oxygen. The air around us, just to give them oxygen through a mask and that reverses a lot of overdoses. And then, of course, the second line is naloxone, which is just a nasal spray. Yeah. And so the single biggest factor in opioid overdose is injecting alone. And so that's the power of a supervised injecting space, because by having someone there that can act when they see an overdose beginning, you can save someone's life.
What do you say to people that agree with supervised injection centres but say, not in my suburb?
Well, I'd really encourage them to think about what they would like to happen if it was someone they loved. We've got thousands of suburbs in New South Wales that have needle syringe programs right now. They give away clean injecting equipment, a fabulous initiative from the 1980s to reduce bloodborne diseases and AIDS. So right now, people who use drugs, they go to those needle syringe programs, they get their clean injecting equipment, and then they're sent away to use it. Why wouldn't we have a small space, a couple of desks within that needle syringe program where those people could be supervised, and also to allow a deeper conversation around what's going on in their lives so that we can create a pathway into treatment or other support services.
Now, you've got a line straight through to Chris Minns because we know he listens to this program. So what are you going to say? What would you say to him?
Look, I would say I know the Premier is a good person, and I would say to him, Chris, you could make a huge difference here to the families and communities of New South Wales by implementing every single one of the Drug Summit recommendations. Just last week we had 2 mums, Lorena and Jess, going to meet with Chris Minns' office to tell the stories of their 2 sons. One story of an overdose, one story where the young man died, and another story of a young man who'd been over-policed and the stigma that created. So I'd say to the Premier, let's end the stigma. The community supports change, your electorate supports change, and it's time to listen to those voices.
Emma Maiden, more strength to you. More strength to you.
Thank you.
Let's see where this goes. Thanks so much for talking to us tonight.
Thank you very much.
Thank you.